Hi everyone, welcome back to my channel. So today this lesson is on the signs and symptoms of the kidney infection, which is also known as acute pyelonephritis. Before moving to the signs and symptoms, let's talk about what actually is acute pyelonephritis. So pyelonephritis is a condition involving bacterial infection and inflammation of the kidney. So one of the more common conditions involving the kidney can be due to an ascending infection from an underlying urinary tract infection, which is also known as cystitis. So, individuals who have urinary tract infection, in some cases, the infection can ascend up the urinary tract and ultimately infect and lead to inflammation of kidney itself. So certain patients or populations are very much have increased risk of having a kidney infection or pyelonephritis, and these are female patients, pregnant patients, patients with recurrent kidney stones are at higher risk of acute pyelonephritis. So let's move on to the signs and symptoms of the acute pyelonephritis will often develop over hours or over the course of a day. One of the hallmark symptom of this condition is flank pain. Flank pain is going to be the pain on the side of the back, and it's going to be more specifically located near edge of the rib cage. So this flank pain is typically radiates from back to front. So pain in the back towards one side again at the bottom of the rib cage. This can also be known as costovertebral angle tenderness or CBA tenderness. So because this is an infection, there can be fever in chills as well as as it is a kidney infected, so flank pain and fever with chills are the two most common symptoms of acute pyelonephritis. Some other symptoms include nausea and vomiting. This nausea and vomiting are very common with pyelonephritis, and often it's going to be due to significant infection. Another symptom that can occur is anorexia. So anorexia is simply a reduced appetite, and this again is common with patients who have pyelonephritis. Patients with kidney infection or pyelonephritis can also have diarrhea. So this is a very rare symptom. It's not going to be as common as those other symptoms you have talked. And we can also see abdominal pain occurring as well. And the more common finding in pyelonephritis is hematuria. So hematuria is the blood in the urine, and this is going to be due to organism irritation. Hematuria is so common in kidney affected patients that it is estimated to affect 30 to 40% of patients who have pyelonephritis, and hematuria itself is going to be more likely to occur in females. Some other findings we can see with the kidney infection include epigastric pain. So epigastric area is the area above the belly button. The symptom is dysuria. Dysuria is often described as a burning sensation while urinating. Urinary urgency is another symptom of urinary tract infection. Patient likes to urinate more quickly or more urgently, and again this is going to be also due to bladder irritation. So let's move on to homeopathic mode of treatment for treating urinary tract infection or acute pyelonephritis. Homeopathy is efficient in treating UTI with holistic approach and considering the patient as a whole with individualization. In homeopathy, we treat an individual but not just the disease, which is the result of deranged vital force. Therefore, it should be treated as a constitutional problem. So the first very effective homeopathic remedy for UTI is cantharis. Only several drops pass at a time with a scalding sensation is a peculiar symptom, and in cantharis, person may feel as if the bladder has not been emptied, still feeling a constant urge to urinate. Cantharis can be taken in 30 potency daily one time. Second drug is Nux vomica. Nux vomica has a symptom peculiar to irritable bladder with a constant need to urinate. Passing only small amounts suggest for this remedy. Sarsaparilla is a most frequently recommended homeopathic remedy for UTI. In this, the patient has frequent urging is felt with a burning pain at the end of the urination. Flakes or sediments are sometimes seen in the urine. Apis mellifica is also an excellent homeopathy remedy for treating acute pyelonephritis. This remedy is indicated when person frequently needs to urinate but only small quantities are passed. Apis mellifica 30 potency can be taken daily 2 times. Then next comes the Beriberi vulgaris. Beriberi vulgaris is a very frequent and excellent remedy recommended for UTI cases. In this cystitis with twinges of cutting pain, urging and discomfort are often worse from walking. This remedy can be taken in mother nature form daily 15 drops in 1/4 cup of water 3 times. Thank you so much for watching, and if you like this video, kindly support me by like, share and subscribing to my channel. So take care and I'll see you in the next video.